Thanks again for inviting me out, Dr. Jimenez. I appreciate the opportunity to talk on this subject again. Last year we spoke about this epidemic, and it's a very important topic both to myself as a physician and I'm sure to many families across the country, across the globe now. We looked at some pretty bleak numbers last time, and I wanted to sort of double back and put a little twist on the talk this time and talk about this new sort of avenue of pain management. I'm sure many of the practitioners who are here get the question, well, what about CBD? So what about it? We'll talk about it today and go over some of the data and let you guys make your decision on your own, okay? So I'm just going to bring this back up. This was from 2017. We had 72,000 overdose deaths that year. The 2018 numbers, we did a little bit better, but we're still about twice of where we were back in 2015. So still have a lot of work to do here. Now, as physicians, we've actually been doing pretty good. This is a USA Today post from July 19th, so from a few weeks ago. And we're noticing that our prescription overdose, our prescription opioid overdoses have actually dropped. However, the fentanyl deaths are on the rise, and that sort of brings to light the problem of the epidemic. It's not just an iatrogenic problem of opioid prescribers. It's also a larger biopsychosocial issue. So just in regards to CBD, we're going to discuss some of the background about the product, go over some of the pharmacology of it, look at some of the evidence, which is very sparse, unfortunately, as with most of these supplements, and then end with some clinical pearls that perhaps you can impart to patients that may make their decisions easier when considering using CBD for various conditions. So in 2018, the Farm Bill was passed that essentially removed the hemp plant or the cannabis sativa plant from the Controlled Substances Act. Now, hemp was used and manufactured in a variety of products and has been used in a variety of products for several years. However, it was never really mandated as a legal substance. So this act officially labeled it as an agricultural commodity. The stipulation was that the CBD product or the hemp product that could be manufactured and sold without prescription, by the way, must contain less than 0.3% of this delta-9 THC component. Now, it's that delta-9 THC component that's responsible for the psychedelic effects of the cannabis. And if you compare the hemp plant and CBD to the classic marijuana plants are going to contain upwards of 35% or 100 times that amount of delta-9 THC. Also, this year in June, Governor Pritzker did officially sign his bill mandating that Illinois become one of the states where we have legalized recreational marijuana. Now, this may, on one hand, make it a little less confusing as a practitioner when patients come in and ask to be placed on the medical marijuana pilot program for medical use. However, on the other hand, I think we're going to get a lot more questions about safety and efficacy and choice of products. So it will be interesting to see how this, when it gets rolled out, will affect the medical community. So just to go over this here, the cannabis sativa plant is a very, very widely used plant. We've got tons of products that come from this, including personal hygiene products, textile industry is using this, and and essentially what we're looking at in medicine is this whole THC CBD component. And I found it interesting that they listed sacrament as a use for THC. But if you go back in history, many of these THC plants were used in religious ceremonies, and the classic medicine man of tribes would use this medicine for healing. So there is some precedence here. Just to dive into the difference between the hemp plant and the marijuana plant, so there's some significant differences here. The morphology of the plant is very, very different, and these have been selected out over time by growers and scientists who have sought to sort of isolate this marijuana plant, for essentially for the use of using it for the psychoactive properties. However, the THC plant, again, less than 0.3% of the THC component is within the hemp plant. And so that's very, very important, because I did just a search on Google, or actually on Amazon, to see if I could come up with a CBD product to offer to patients, for instance. And what comes up is over 1,000 results for CBD already, and this is within the first year of the passing of the bill. And now, if you notice, most of the products are labeled hemp oil, and so the hemp oil is the extract by which we derive the CBD from. So hemp and CBD oil, in many instances, is being used interchangeably. Just to go over a little bit of the basic science, if you look down, if you can see these structures, they're very, very similar if you compare CBD and this delta-9 THC structure. The difference is that the THC structure has an extra cyclical chain within the structure. This allows it to have greater permeability into the central nervous system and better binding affinity for the cannabinoid, or the CB1 receptor, which is in the limbic system, and it sort of drives that psychoactive effect. Whereas the cannabidiol, or CBD, structure actually acts as a allosteric inhibitor of that central receptor. So basically what this means is that CBD will block the psychoactive effects of THC within the central nervous system. So most of the products that you're going to see will be combinations of CBD and THC, and they're sort of antagonists of one another. So there's approximately 4 products that have been manufactured that are specifically cannabinoid products, or cannabinoid products. Many of us are familiar with Mirinol for use for failure to thrive, or cachexia, to promote appetite, for instance. But there are also products on the market now where we're treating epilepsy. Also, there's a product which is also an extract of CBD called Sativex, which is used for spasticity in multiple sclerosis. So we're getting closer and closer to that musculoskeletal frontier where we're starting to see more of the pharmaceutical companies look closer at developing products for that. Now, the effects are typically used for analgesia, for antiemetic effects, anti-inflammatory, anti-anxiolytic effects, anticonvulsants. And then there's also this antioxidant cytotoxic effect that they're seeing from CBD. So many of the pharmaceutical companies are looking at certain CBD extracts now for support of cellular health, for instance. So in 2017, there was an interesting review of these systematic reviews. It's somewhat of a meta-analysis. Now, again, the studies aren't great, but this was a German study, and they looked at approximately 11 papers. What they were able to conclude from their study initially was that there was inadequate evidence. They were looking at, was there an effect of CBD in managing pain or in managing symptoms in regards to palliative medicine? And they really couldn't find any sort of evidence to point to. That same year, an interesting study came out looking at osteoarthritis in rats, actually. They were able to extract some of the synovial tissue after administering CBD to these rats, and upon analysis of the tissue, were able to determine that there was reduced leukocyte activity, decreased swelling in joints, in the joint, synovial fluid, attenuation of the inflammatory processes, and reduced breakdown of the nerves. So this was a very interesting study, and it sort of piggybacked the movement for CBD in usage for pain. So looking a little bit at this system, this endocannabinoid system, if you look at the mechanism, you have this CBD product, and these systems are present in many cell lines within the immune pathway, also within the musculoskeletal system. And the CBD acts essentially as a receptor agonist, meaning that it will bind to this G protein coupled receptor, and it will essentially decrease the presence of interleukins. COX, for instance, is downregulated, TNF alpha, and cytokines. And so this will give you that decrease in inflammation and attenuation of the inflammatory cascade that we look for in treating musculoskeletal pain or osteoarthritis, for instance. So this is a very interesting development because this system is being targeted by many pharmaceutical companies as we speak, as there's a push to develop these medicines. So this same group kind of doubled back, and I'm going to take you guys through the papers that I was able to sort of bring up from this year, and they actually sort of changed their tune. And I think that the problem is that there are no good randomized controlled trials, so we're not really comparing CBD head-to-head with classic NSAIDs or acetaminophen or opioids at this point. And that's made some of the evidence a little bit muddy to interpret. But now the stance is that there may be moderate quality evidence for moderate relief of neuropathic pain, and maybe some consideration as a third-line therapy for chronic pain as well. This was also published back in May, and it was looking at any efficacy for use specifically for joint pain in RA. And it turns out that they were able to identify a different type of activity on the receptor. So the CB2 receptor actually must have antagonist activity in the periphery in order for it to be effective in decreasing inflammation, and therefore this was sort of counterintuitive. Prior to this, the thought was that these CB1, CB2 receptors were agonists or activated the decreased inflammation through agonist activity. And so therefore, this study did demonstrate that, in fact, we should be looking at developing different sort of drugs that have both agonist and antagonist activity. They did determine that there were some immunosuppressive effects that they found associated with RA and the autoimmune destruction of joints in RA. So very interesting study here as well. And then in terms of perioperative cannabis use, so is the question of individuals who go into surgery, while they're using or when they emerge from surgery using this postoperatively. This group did a review on this subject, and it's interesting the effects of CBD or cannabis products that it has, and that you may want to consider as a practitioner. So decreased intestinal motility, for instance, is one of the interesting findings that CBD can produce post-operatively, lower esophageal sphincter relaxation and reduce gastric acid secretion. So that could potentially be problematic when you have outcomes, particularly in GI surgery. It promotes appetite, reduces nausea, vomiting. And then we also found a reduced narcotic requirement with concurrent use with CBD products and opioids. So that was also a very interesting finding from the study. And again, these anti-inflammatory effects were also identified in this study as well. So in the last couple of slides, we're just going to go through some things that I hope may be beneficial for you as practitioners in educating patients. So the administration of the CBD can be oral, inhaled, obviously, through vaping or combustion. It can be used as a sublingual drop or applied topically. There's a significant first-pass effect with many of the routes of administration, and therefore the inhaled and the sublingual routes tend to give you that best therapeutic index, and it's a wide therapeutic index. The dose can range based on the product as high as 50 milligrams per kilogram per day. Some products have been manufactured where patients are using that much. If you look at most of the online products, the recommendation is for 20 to 40 milligrams of the product per day. So over to the right, this is sort of an example of a company that I have worked with in the past, and their dose recommendations are usually 1 to 2 drops of the extract or 1 or 2 capsules of the extract 2 to 3 times a day. So you're falling kind of in that same dose range. So a few things to just consider for patients. CBD may have a role in decreasing pain and inflammation, but we do need more studies, particularly head-to-head randomized controlled trials. It has the best medical evidence to date for epilepsy, cancer pain, neuropathic pain, neuromuscular disease. And usage of CBD in conjunction with opioids could potentially lower that overall narcotic requirement for patients, which is very interesting if you're considering use in the perioperative period. And also, you can kind of educate your patients that CBD will not get them high, so to speak. The component of THC available in these CBD products is negligible. Low side effect profile. And then the sublingual preparations appear to offer the safest delivery system for optimal dosing. So in summary, this is a very rapidly evolving industry. We need more evidence-based medicine, obviously. We talked about the dose recommendation, and we should consider this, in my opinion, as an adjunct for therapy in pain management, but obviously I'm open for argument on that. Thank you.